Hello, my name is Stephanie Lomeli, and today we're going to review how to make record bases for maxillary and mandibular complete dentures. Now, the final product will look similar to this and will be the next step in making your occlusion rims and finally setting up anterior and posterior teeth for your dentures. Now, some key things to take note. If you saw the last video, we discussed many of the important land features. Now, the most important thing in today's will be to make sure that you are 2 millimeters in depth from the land area of the vestibule. Okay, now that's going to be because anything over 2 millimeters will make it difficult for the triad to cure. Another thing you want to take note of, if you look right here, you can see that it is fractured. This is actually a cast that I have done multiple practices on, and if you do not properly put MRA in it, it will fracture. And that's because the stone and the triad adhere to each other. So I will not be going through the lockout wax and relief wax as well as the 2 coats of MRA because I already discussed that in our previous video of the custom impression trays. So good news is if you mastered those skills, you'll be doing extremely well on this too. Now you'll notice that this is going to be an extremely short video because many of the methods translate from the custom impression trays to the record bases. So let's turn that off now. Okay, so same as before, just as you unwrapped it. Now one of the things you'll notice is this material is a lot more pliable. The more you kind of touch it, the more flowable it gets, so you want to put it down right away. It won't be as hard as the clear material. So just like before, you want to apply pressure downwards, okay, and then you're going to roll out, just like the rap song. Okay. See how I'm rolling down? And again, down the crust, from the height of the crust downwards. Okay. Now, the thing that is particularly different here is where on the custom impression tray you want it to be short, on the record base you actually want to come right up to the edge. Okay. So we want to essentially fill the vestibule. Now what we'll be doing here is taking the knife and cutting along the land area. Right, so we're cutting over. So all of this excess material we have, we can just tuck it in. Okay. So you want to cut it over, but not too far over. One of the reasons is because when you tuck it, if it's too far over, it will start to fold, and that will create air bubbles. Okay, so trying to go from the top downwards. So see how kind of folds up. Okay, so that's a good example of when you have too much. So you can also use this little instrument to take away any excess. Okay, but you see how it gives it a less smooth cut. So again, you see how it goes all the way to the depth of the vestibule vestibule, but it's still not filling it in, right? And come by, get it just a little bit of a closer cut. See how it just peels away. Now once you do that, we're just going to go ahead and kind of roll it down, right? Make sure that there are no air bubbles in there. Now what that brings us next to is you're going to have varying dimensions here that are going to be of importance. You want the crest of your ridge to be at 1 to 1.5. Now keep in mind that initially you were at 2.5. So what that's saying is you need to reduce an entire millimeter of depth. How are you going to do that? Well, you're going to simultaneously fill the vestibules by pushing down. So significantly more pressure than what you were using on the palette, as well as more pressure than you were using previously. Okay, so see how it's already going kind of over? So that's kind of why you want to be a little short. Okay, so see how the color is starting to change to kind of a translucent color here versus the dark pink that you see. Okay, so that's kind of what you're shooting for. Once you see that translucent kind of yellowy orange color, you know you're getting to the right thickness. Okay. So the crest to the labial surface. Can you hand me a Q-tip? Okay, so you can wipe a little here on your glove. Then thin later. Again, just like before, you're basically, look how minimal MRA there is. It's literally just enough that it wets it to coat it. Any more, like you don't want even a goop. See the difference between that? That's a goop of it. Literally just want it slick. Okay, so now, so with the Q-tip in your fingers, you're essentially going to be doing this back and forth motion. Okay. So using your index and your thumb, back and forth. Okay, so kind of practice that first, get the finger movement. Once you have that, see? So same thing, now I'm using my other fingers to kind of support it, but it's basically the index finger and your thumb that are actually doing the movement. The rest of the fingers are just supporting. See how smooth that is? Look how beautiful that is. Perfect. Very minimal effort. See? Then out the slope. Okay. And if it seems like it's too much, look, you can easily just take a little out. And again, just flatten it out. Stuff it in to that. Most important thing is that the vestibule is full and that it comes all the way to the peripheral edge. The peripheral edge is this edge right here, okay? And so we'll just do that all the way to the end. With your number 7 spatula, you can rub the posterior border of the palette and smoothen that up. Next, you can cut out a small area, horseshoe shape. This will essentially allow for any polymerization shrinkage of the palette to be minimized because you've removed it and cured. Now this little piece here, you want to cover it so it doesn't start to set, and during that time we're going to move to the mandibular. Now the mandibular is going to be done exactly as we have just completed and exactly as you did on the custom impression tray. So you'll start to see how those skills that you learned and mastered in the previous weeks translate so perfectly here. Now again, make sure you have plenty of MRA. And the MRA has had the 2-minute time to soak in, so that way you don't have any fractures. Now this cast, you'll be using it for the next 3 labs consisting of record bases, which we're doing here, occlusion rims, which is adding a wax rim to it, as well as the teeth setup. Okay, so we place it down, and now essentially going from the crest, not pushing too much pressure on it. You want to roll it down. Same here. Came up a little short there. So we're going to glide across. Okay. And again, just came up a little bit short, but ideally you'd like to come right up to it. Okay, we're going to turn off. Now it's, so right about this time, see how far we made it? And right now the 2-minute time was just up. So another reason it's essential that you work on them simultaneously. Okay. See how I pulled away all of the excess. Now we'll just tuck everything down. Now the thing with the mandibular is we will actually be adding a piece of triad material to the lingual to make it a thickness of 3 to 3.5. So we want the retromolar pad to be about 2, the distal lingual to be about 2. We want the lingual sulcus area here to be about 3 to 3.5. We want the buccal shelf to be 2. And then in these areas, the slope, the lingual slope, the buccal slope as well as the labial slope and the crest, we want that to be 1 to 1.5. Please refer to your manuals for all of the exact dimensions. Now again, just as we did before, to thin out that crest and fill, see how you start seeing that translucent color? Okay, so as it has thinned up, and once you are satisfied with how it has essentially been filled up. You don't want it to be too yellow. See how it's super, super yellow right there? This is a perfect example. Versus about right here. That means it's getting a little too thin. See how I'm pinching it? And it went away? Okay, again, right here. Just gonna pinch it slightly. It's all about manipulation of the triad material. Okay. So now we're gonna add our second layer. So we're shooting for that 3.5. Okay, just gonna add it there. Now this will give it strength so it won't fracture. And then again, you'll just go back. Just stop it. Okay, so you see how there's that first coat and second coat? See how easily it blends? Okay, so you're just gonna do exactly what you did previously. Make sure that you're coming all the way to the edges. Now, the most important thing to take note of is that this area here doesn't get too thin, the shelf, as well as the distal lingual and the retromolar pad. Those areas get thin so easily, so you really have to be very diligent and very purposeful at the very, very end to just come along and double check all of those areas. Okay. And if you think that it's getting too thin, remember you can just pinch it ever so slightly. Now we're going to trade this out. So, key things to take note of. Now, the other reason I think it's very important that you're switching back and forth is because you want to feel for it. Right after the 2-minute period is when the triad is going to be at its hottest. Now, one of the things that you really want to do is avoid manipulating it when it's hot, taking it off of the cast. So polymerization distortion is going to happen when the triad is hot. So at 140 degrees Fahrenheit, which is about 83 degrees Celsius. Might want to double check that, it's important to know. You're gonna have that polymerization distortion. Anytime it's off of the cast, you're gonna have that polymerization distortion. So as we're putting the little piece that was missing, we're just gonna blend it back in. Okay. Now, as you notice, it's always going to seem like you don't have enough material. Now, that's going to be because of that shrinkage. So you might need to add a little bit because it's pulling away. Okay, so you're always going to need just a little bit more. Let's see, I think I just threw away my extra. And look, I kept some from earlier. Okay, so we can add just a tiny bit to this. Okay, and if you find that you've added too much, look, we can just pull it off of the edge. Okay. So just a little MRA, and we're just gonna blend everything nicely. Okay. See how that blends really nicely. So just want to make sure right before you take it in that you just kind of come along. Everything's blended in nicely, and you can switch it out. Now at this time you want to use your red handled knife. See, it's already coming up, so I didn't need really my knife. Okay. And you can use your calipers to see where it was too thin. And see, I'm at about 0.5 millimeter on that side. So this is a perfect example of, now bring up the camera to the light. Can you see the different colorations? Now I did that on purpose for this example so that way I could show you what a thicker color was. So that's a little too thick. This is going to be closer to what you're wanting. Here is way too thin. Again, closer to what you're aiming for. Can you see those differences? Is it coming out? Good. So when we come over here and we measure, see we're getting 1. Okay, and do you see how that was the area that I said was closer? Here, about 1.2. Okay. And see the area I said was too thick? 2. All right, but let's see where we are on the retromolars pad. Bam! 2 exactly. See that? How about here? Ooh, just over 2. 2.1. What about here? 3.5. And you see how pink that is right there? So being able to identify your differences in color, too thin, just right right there, getting on the too thick side, thickness, but perfect thickness in the appropriate area, but still translucent. But see how this is not translucent at all? Because that's your 3.5 that you're aiming for. Okay, now once you do that, all you need to do is trim it up. Now this is going to be done exactly as I had shown you previously. So I'm only going to do one short corner. Okay, now zoom in here. So the major difference here is because we put the record base up to the periphery here. Sometimes there were times when we had a little bit of what's referred to as flash. Can you see this here? Okay, so I'm gonna flip it up now. Are you zoomed in still? Okay. I'm gonna flip it so you can see what it looks like on this side. Can you see how we have nice clean borders, but there's a little area here, right? Slight. You can feel it with your finger too. So rub your finger across it right here. Okay. You can even, depending on how thin it is, flick it off with your finger. So that's a really nice part too. Okay. So using that cotton, we'll get it nice and smooth like that, okay? Just gonna rub that little, right, so we can see where we're coming up to. Okay. So now, are you still there? Zoom in. So holding it upright. So you're trying to get that very edge. See where the line is? Or zoomed into that point? Okay. And then you just want to, after each little, you want to rub your finger. I can still feel a little bit of a roll there. And I mean, God, it's literally the most trivial amount, but it counts. And when they're testing you, this is how they're going to do it. They're going to come, they feel something, up, that's a deduction. Okay, up, feel that sharpness. Oh, look at that sharpness, deduction. Okay. So watch out, you don't want to come at too much of an angle because you'll make it short. Okay, so very, very smooth now. Same here. And see, so that's why I'm holding it more flat. So anything that's protruding over that border is being captured as opposed to making it short. Okay, So that's all for that area. Another thing is I was talking about the air bubbles. Come here. Let me dust off. Okay, so can you see me clearer now? Okay, so another thing was with the air bubbles. If you can zoom in right here. So one of your deductions is going to be if the intaglio is the undersurface or the tissue surface, right? So is the tissue surface smooth? So see these little divots here? This is probably the biggest divot. That comes from the air bubbles, okay? But do you see how all of this is very, very nice and smooth? So just depending on how it's graded, you may or may not get deduction for that. So you want to be very, very aware of that. Now the very last thing that we're going to show you is you want your frenula to be slightly thinned and short rolled borders. Okay, so look at the exact terminology of your grading. It's very, very important. Okay, so I'm just gonna roll in here. Okay, so you see how I'm rolling those borders? Okay, and now I'm gonna smooth it out, thin it up a bit. Now, what is this going to do? This is going to allow for so it the material kind of clumps up a bit right here. Okay, so you want to thin that out so it's not excessively thick. Like if you look right here, this is literally thicker than any of the other part of, okay. So again, just roll it up. Okay, and then just thin it out. You're just trying to get rid of that excess and that really happens when you're, like it kind of puckers right there, okay? So you're really not thinning it too much. Just think of it as you're just removing the part that's kind of puckering up, okay? Now, for time purposes, I did it really quickly, but if you have the time and can spend a little bit more time there before you cure it, then you can get rid of that pucker prior to curing. Okay, now if we come over here, we can see how it's just slightly thinned. And there's a little room for the frenula movement when you have it in the patient's mouth. When you have the record base in the patient's mouth. And see how smooth the edges are, and they still come right up to the peripheral. Right up to peripheral. Okay. And that's it. Thanks for joining me on this session of record bases. Now, I have another video that discusses how to do occlusion rims, as well as setting up the anterior teeth. If anything today did not make sense, please go back and watch my denture overview video or my custom impression tray video, which will have a lot of the key steps that you'll be using today. Now the other thing is, if you master the custom impression trays, I think you'll see that a lot of those ideas translates to the record baits. Thanks guys.